I wrote this book, A Return to Healing, because we must make the shift from a disease care system to one that's focused on wellness and prevention, a true healthcare system. And we're writing articles all the time about what can we do to shift this dilemma that we have. Back in 2009, we were talking about real healthcare reform for a short time, and then we got into insurance reform, and really that's what we wound up with for the most part. And you can see what's happening in healthcare just by following the money. Why did President Bush twice veto a bipartisan bill to increase taxes on cigarettes to fund 10 million uninsured kids? And fortunately, President Obama did something one of the first things he did is sign that bill into action. Why do we spend $100,000 for each premature infant that has a low birth weight when we could be teaching how to prevent the most common cause of it, which is smoking? Why is the FDA riddled with conflicts of interest? And why are we looking at Congress in a way where we're distrusting that they're trying to help us to cut health care costs and to provide a good system that makes sense? Well, in my book, A Return to Healing, I talk about a 5-point program that I think could help us to have a more healthy America and to shift this paradigm. Of course, we've got problems that are economic because $2.8 trillion could be cut by 90%. If we weren't sick, we wouldn't spend the money, and then we'd have the money to spend on people who happen to be really sick using what is the best healthcare system in the world today, which is in the U.S., but we can't afford it, and there are a lot of disparities, and that's why we're ranked 37th in the world. So what is this program? First of all, I think exercise is a program we should all be involved with. It should be taught in schools at every level, starting with preschool and kindergarten, all the way through high school and college, and even PhD programs, including medical schools. We should focus less on trying to worry about academics, which are indeed important, but we know that if we're physically fit, we do better academically too. We should tax junk food, things like that have high fructose corn syrup or sugar in it, or trans fats. All these things should be taxed so that we are supporting foods that are healthy for us, and we're sustaining agriculture the best we can with our funding. And we should be funding certain kinds of supplements, such as vitamin D and essential fatty acids, because there's a widespread deficiency of that in America. We should have comparative research that's done in a way so that we're looking at head-to-head effects of different drugs or of supplements or of nutritional approaches and any other approach you can think of to compare with each particular solution we have for our healthcare issues. We should support preventive screens that are good ones, and I don't mean the ones in general that we're doing too many of, but things that can predict in advance, that can look at our wellness buffer reserves. Those are the tests we should be looking at, as long as they're non-invasive and they're not expensive. We should be banning direct-to-consumer ads, and we should be trying to support healthy lifestyle ads. The ads that are direct-to-consumer are only legal in 2 places, the United States and New Zealand. Every other country has decided not to allow it because we know that it just encourages people to use more in the way of drugs that suppress symptoms and don't really deal with the underlying causes. So I urge you to take a look at this book, A Return to Healing, because it really, you can get it on Amazon or you can get it on my website at drsaputo.com. In fact, we're giving a 20% discount on that book at the present time. And it will tell you about what you need to know to shift the paradigm from disease care to health care, so we focus more on lifestyle and non-invasive therapies and natural things that we can do to try and help us before we have to resort to drugs, surgeries, and technology.